Hey, welcome to Native Roots Radio presents a COVID-19 conversation in Indian country. And we have our co host, Dr. Stately, and our producer, Haley Cherry, here. And we're going to be discussing, how far we've come and where we're at and all these things that, I don't know, Dr. Stately. Welcome. And Haley, do you mind reading Dr. Stately's bio? And it's just great to have you on and have this conversation of reminder of how far we've come and how far we got to go and where we're at now.
Yes, we're here with Dr. Anthony Stately, Ojibwe in Oneida. He is the Executive Officer and President of Native American Community Clinic, or NAC. Dr. Stately received his PhD in clinical psychology from California School of Professional Psychology at Alliance International University in 1997. Native American Community Clinic provides primary care, dental care, behavioral health services to the Twin Cities Native American community. And he formerly worked as the director of behavioral health programs at the Shakopee Mdewakanton Sioux community in Prior Lake, Minnesota. Previously, he was a research scientist and director of the Center for Translational Research at the Indigenous Wellness Research Institute at the University of Washington, Seattle. He's also director of client services at AIDS Project Los Angeles and the founding and inaugural program director for 7 Generations Child and Family Counseling Services in Los Angeles. He's also taught in clinical graduate programs at UW School of Social Work, Antioch University in Seattle, Phillips Graduate Institute, CSPP Alliant University in Los Angeles, and Loyola Mount University. He's also served as a consultant advisor to the CDC, HRSA, and the Native American AIDS Prevention Center. Welcome, Dr. Stately. It's a pleasure to be here again with you today in this COVID-19 conversation.
Thank you. It's lovely to be with you as well.
Dr. Stately, Pinigi, yes, thanks for being with us. I think these conversations we're having and we're going to have later on too with our friend Heather, the pharmacist, is really important reminder. And, I think there's a lot of amnesia out there and people in denial and things like that. So I think it's really great to talk about kind of where we're at right now, which is we're kind of sheltering in again and and vaccines and things like that. Let's talk a little bit about where we're at.
Sure, for sure. Well, so just to kind of center the conversation, we're specifically in the state of Minnesota, and when you look at the state of Minnesota data, you can see that like the COVID vaccine, the COVID crisis, which people, I think you talked about amnesia, like when people forget that we're still in the pandemic, that the virus is still out there, it's circulating. The particular virus variant that we have now is fairly, highly transmissible. So, I remember, I think in earlier conversations I've had with you, like I know people who went to like an open air event, like the powwow, and they might have gone to concerts and they were like, outside with large groups of people sharing space, maybe not sitting right next to each other, but they're in sort of social space, but it was outside. And part of it was that they ended up getting sick with COVID and kind of surprised by that, those individuals. And part of it is like just the nature, but I think there's a confluence of things happening. One is it's a smart virus. It mutates and transmits, and it's becoming more stealthy. It's easily the virus we have that we're living with today, and the mutation. I can't even remember what number of mutation around. It's had to mutated like 10 or 15 times by now over the last 3 years.
Wow.
That particular variant, the CDC sort of like has been saying is like very stealthy. It is easily transmissible, so it means it's easily acquired. You're more likely to catch the virus and to develop symptoms if you don't have a vaccine. Even if you do have a vaccine, you might still get the virus, but your symptoms will be a little what we call attenuated or less severe, which is a helpful thing to know. But I think part of that is like we're 3 years into this, starting our 4th year. So like, and remember vaccines rolled out in December of 2020. So here
Wow.
we are, it's December 2023. 3 years ago, we were vaccinating people. We had just lived through almost an entire year of people dying from COVID,
Mhm.
hospitals filling up, and just kind of like, let's do some like level setting here.
Mhm.
People were, there were large communities and cities where people were filling up morgues and hospital rooms, and like people were in, you know, like
Coolers.
we had bodies in coolers,
Yeah.
and it's like there was just like we're nowhere near that anymore. Like, and that's been the direct benefit of having a vaccine and the scale of response that we were able to launch. But what we have to recognize is that, for a large segment of the population, older people who are very, very young, who haven't yet developed their full immune system, people who are older, who have specific health conditions, are much more likely to be quite vulnerable still to this virus that is circulating and changing all of the time. And a vaccine will help significantly. And even with that, we're likely to still have some mortality and some severe conditions. People with because the efficaciousness of the vaccine, even while it's very, very effective, it's not 100% effective.
Mhm.
And there isn't, in medicine, there just isn't anything that is 100% effective for everyone on the planet. That's an important thing to understand. So thinking through, like, having conversations about like what can I do now to protect myself, protect the people that I live with, the people that I love, the people I work with and socialize with. Like, what can I do to sort of like prevent myself and the people that are meaningful to me in my life, um, uh, to make them the most safest that I possibly can.
Mm.
And if you are able to do that, stretch it a little bit further, and practice being a good relative and keep everyone safe, because the pandemic has taught us one thing, if not anything. It's taught us that our well-being is connected to each other as human beings. We are relatives on this planet. Taking care of each other is the one thing we were given instructions to do it by Creator when we were sent here.
Yeah. Well, one of the things, maybe we'll wait until we talk to the pharmacist, but I was curious, do people think that if they got the first, shots or first couple shots a few years ago, that they're good right now? And then really, where is that? Do these vaccines wear off, or is it just specific variants that we're dealing with when we get another vaccine?
I think it's a couple things. One is that both of those things are probably operative. So, like, there's a reason you get a flu shot every year, or
Mm,
if should you like be a like I get a flu shot every single year. I
okay.
get a pneumonia shot vaccine. I think every 2 years, 2 or 3 years. I can't remember the schedule. Anyway, my primary doctor will tell me like, hey, you're ready for your your updated um, uh, pneumonia shot, those kinds of things. I get like my tetanus shot every 8 years because I don't want to get tetanus. That's a pretty horrible thing to get if you don't.
Right.
It just takes one, rusty nail to really change your day. Um,
Yeah. Yeah.
right. And so I think like that's the nature of it. Like, our immune systems aren't like, we're not one, I was going to say, we're not computers. There's a lot of sort of like similarities to like the way that computers are structured and the way that our bodies are structured, but we're not like, once you introduce something in there, it stays in there forever and you're always going to have it. Some things are true. Like an example, I I acquired HIV in 1991. I'll have that virus for the rest of my life, but I'm managing it really well. I
Mhm.
haven't had any long-term effects lately. I've been managing with medication for a really long time. I'm what's called undetectable, meaning they can't really see any significant demonstrable trace of virus in my blood.
Mhm.
When I go in, my T cells are great, meaning my immune system is functioning fairly well. Um, it was interesting to me, like as an example, I did get sick recently, I think like the beginning of October.
Mhm.
And I had had a doctor visit like the day before I got sick. I got my COVID vaccine and my flu vaccine on that day. It was a Thursday. Friday morning, I woke up. I was really not feeling well, kind of feeling off a little bit.
Hmm.
Left work and got home, and by noon, I was like laying in bed, and I slept for about 12 hours. Tested negative that day for COVID, and the next day I was positive for COVID, and that was the worst day. But
Mm.
part of that, when I went back to talk to my doctor, because they called me and they were like, "Hey, your test results are saying this and this, and like, and your T cells were fairly highly elevated that day, and if you have a few other elevations that day." And one way of explaining that was like what they were seeing probably in my serological or my blood work on Thursday, the day before I got sick, is the fact that I had acquired the virus and I was mounting my response, right? So there's a lot of
Yeah.
biological activity on in my blood in that day. So we are designed as human beings to like, respond with we have really healthy immune systems and we have all things are, working fine. Our immune system has this experience where we're exposed to something, it launches a response. So even before you actually know you're sick, even
Mhm.
before you start to feel something, your body is starting to sort of respond. Like on Thursday, I was fine, but my blood work showed like
Wow.
something's going on. These levels were kind of rising in a couple of different places.
Crazy. Well, and then too, I think kind of an example too of my experience. You were stopping by to drop something off. I had just gone to a meeting and then went out for breakfast and was kind of feeling like Grandma Nissen would say a little punk. And you came by and basically uh, asked Wendy and I if I had taken a COVID test, and we were both like unbelievably dumbfounded because we talk a lot about this on our radio show, and I do say unbelievably, and we looked at each other and it's like, oh, we got some tests here. Let's take a test. And I'm like totally in denial because I've not gotten COVID in these 4 years, and I've been out in the community per se, pretty much, especially after getting vaccinated. And I showed up, I had COVID. And then I had to text Mr. Dr. Stately and say, I have COVID. And he said, I told you. And also that whole process, and Dr. Stately too, I was in a little denial because like a couple hours later, so let's take the test again. Really. But that was a thing that I personally haven't had a cold in probably 10, 15 years. And I worked with
Mm.
students, so I thought I was invincible, I guess. And I think Wendy did too, because I haven't had a cold in many, many, many years. And that's what it felt like, is a cold was coming on. And then the next day was the roughest day. I didn't really get out of bed. And then I took that drug that you recommended, and I bounced back to 90% the next day. So I had, because of my vaccine and because of other things, um, I had a really short COVID kind of a thing happening, and then we can talk a little bit more what happened after I stopped taking that drug that really brought me to 90% and felt better. And I was still working. I didn't go anywhere because you're supposed to stay in, what, 5 days and then mask for 5 days,
Yep.
those things. And Wendy was on it. She had the calendar out and how we counted, because we those days blend in, and I'm glad she did,
Mhm.
because you have to keep track of that stuff because you don't want to give it to anybody.
Yeah, no, you did all the right things for sure. Really, a medical provider, I think, in your specific condition, it did. But I think generally speaking, I think what you're talking about here is like sort of like, we're 4 years into this, starting
Mhm.
our fourth year. We've had a lot of times to sort of live with it. We've become a little acclimated to it. maybe if like, you've gone several months, years, not actually had COVID, you're like, by the way, congratulations on being a Novid for 4 years. That's pretty remarkable. I don't know a lot of people that had that.
Yeah.
And I think that part of it is like, we just got a little bit, you know, acclimated to it. We got a
Yeah.
little bit sort of like, comfortable. We let our guard down a little bit. And the
Mhm.
nature of that specific condition is that it's very stealthy. It's always kind of like mutating, and it's kind of around the corner, right? Lurking in places. So I don't want to make people fearful, but I would do this, say that I would like tell people like start paying attention to it, like pay a
Mhm.
little bit closer attention to it. We are, I know it's hard to believe because it's really warm out. It's like 40. It was, well, yesterday it was 44 degrees out on
Right.
December 16th, which is really odd. But
Mm.
it's colder now, so we're not outside as much. We're indoors. We're having, it is the winter holidays are happening. People are doing, they're exchanging gifts, they're spending time
Right.
together, celebrating, spending time together, doing all kinds of things, sharing food, sharing. And well, the other things that they're sharing is the viruses that live in their body and in the air. And so part of it is recognizing like we have a whole 4 years of lived experience on how to sort of manage it and manage it well. We just got a little bit relaxed. We got a little
Mhm.
bit, it's not amnesia, but like the back of our mind, because we have other priorities we prioritize now. So part of it is just sort of like pivoting and refocusing and saying, oh, we have to remember that this thing is still here, and then mobilize some of the things that we've done over the last 3 or 4 years and we've learned to do. We have to remobilize those things, you know.
Well, and that's what's great about our conversation today, and then we're gonna bring on a pharmacist a little later and talk about, the safety and the history of these vaccines and, debunk a few things for sure that might still be around, but I just have to use my own personal thing, Dr. Stately, and that's like we talk about it. We have a national radio show where we talk about it, and that was not in my jam until you came over and jokingly or not jokingly said, "Have you taken a COVID test?"
Yeah, no, I wasn't joking on that day. You were like, when I asked you about it, you were telling me like your symptoms, and I was like, that's exactly how I
Mm,
was feeling in a lot of ways. So I was just like, I was just like a recommendation: take a test, just do
yeah.
yourself a favor and take a test. And so I was actually surprised that you had it too, but like, it's good to know.
Well, I think
Well,
like holding conversations around COVID-19 is so important, specifically in our Native communities, just to share these facts and the statistics and the research. So we know that back in 2020, we know the ethnic group, us as Native Americans or urban Indians, whether even, reservations all across the state of Minnesota, especially in our northern area, we were leading the numbers of people testing positive for COVID. And looking here on the state, so this is stats.web.health.state.minnesota.us. This shows case rate by race and ethnicity here, updated within the last 7 days. And this is showing the graph from the beginning of the year. So the beginning of January 2023, we're wrapping up, we're December 2023 now. And currently, our rates right now are skyrocketing. Through the month of November, it looks like we've had a peak, and we're so high compared to the other races in the state that we're peaking off the chart right now, which is very concerning. So COVID is still a real thing, and it's very active, specifically right now in our Native communities.
Yeah, in the state of Minnesota, we lead the case rate still with active COVID infections, hospitalizations, and sadly, we also lead the cases and the number of deaths.
yeah.
Um, that has a lot to do with like, I think there's a lot of variables that are related to that. One is like there's just not a really strong healthcare system in rural areas where there's tribes, right?
Mhm.
Um, there's also, we have a couple of other things like, people might have not gotten their regular healthcare over the last 2 or 3 years because they've been focused on other things.
Right.
They've been trying to like, you know, keep their houses and keep their homes. They've been trying to find ways to feed their families. People have lost jobs, specifically in poorer communities, which impact the Black and Indigenous communities more greatly. And so these are real things, and then that impacts like whether or not you're going to go and get healthcare, whether or not you're going to pay attention to things like, we all have a hierarchy of sort of like the things that we think are the most important versus the less important. And so if like COVID has been absent from your mind for a while because we're exhausted by it, we're exhausted from the experience, we've gotten a little bit relaxed because we had vaccines, we've had a few other things. So we think, it doesn't help like you have leadership around the world saying like the pandemic is over. That's not helpful.
Right.
And so there's a number of things that probably are contributing to that. And, you had some people probably, 100,000 people lost Medicaid after the emergency order was suspended, and people had to get redetermined and re-enrolled in Medicaid in some states.
Yeah, definitely. And we were at a event together, and again, it's great that we're talking about this, Haley and Dr. Stately. It ended up being like a COVID spreader, and I was in shock. We were at the 50th floor of the IDS building, and in kind of a cramped up area with a lot of people, and I'm just running around hugging people and shaking hands and not really thinking about it. And then we see on Facebook a lot of our relatives came down with COVID at that night, and it was like, again, that was kind of a wake up call, but not enough for me to have it in the forefront. So really, Haley and Dr. Stately, this is like really important that we're talking about this again.
And especially if you are going into public groups with a lot of people, it's so important to test for COVID. So some tips for doing specifically some COVID-19 self at home tests. Follow the manufacturer instructions. You want to get an accurate result, the most accurate result that you can get. So if you have symptoms of COVID-19 and you get a negative test result from your home test, you should repeat that test, whether that's right away or definitely within the next 48 hours to confirm that as accurately as you can. If you do not have symptoms of COVID-19, but we're in close contact with someone with COVID-19 and you get a negative result, you should also repeat the test 2 more times. Specifically, they recommend 48 hours apart each time to confirm the negative result.
Yeah, it's Haley and Dr. Stately. It's an important conversation we're having here. We're gonna later on the show have our friend Heather, who's again a pharmacist that does a lot of the vaccines and knows about the vaccines, and we can talk about the safety and debunk a lot of things. And I think it's important. This is just such an important conversation we're having.
Yeah, absolutely. I would say that it is probably, really critical at this point in time for us to be encouraging people in our community to do as much as they possibly can to have their relatives vaccinated. If they haven't had a vaccine since 2022, like, maybe people felt like, oh, I already had those vaccine series. It's like the newer vaccine now, the one that just was sort of like released over the last few months, has has been has some new information about like that is able to sort of respond to some of the new variants, will make it a little bit more effective. But we were talking, remember earlier, about how important it is to sort of like, vaccines don't mean you can get a vaccine now and it won't necessarily protect you for the next 3 or 4 or 5 years. It depends on what vaccine we're talking about specifically. Like, for instance, there are vaccines you can take that will protect you for several years. Those are things like, tetanus. You don't have to take that every year. You take it every 4 or 5 years or something like that. This is a particularly smart virus that transmutes and changes over time. You probably it is likely, and we can talk with the pharmacist about this, but it is likely that we are in the day and age where we're going to have to like treat COVID like we treat the flu and like we treat some of the other sort of like seasonal things that visit us, like RSV and a few other things, will have to take a vaccine every year annually for it. And really important for people who are critically more vulnerable, older people, people with immune deficiencies, and young, really, really young people.
Point.
Yeah, that's
What are
awesome.
some of the symptoms that we're seeing present in people who are testing positive with COVID recently?
I think a lot of people, my experience, I think also Robert's experience, and some of the people I've talked to recently who have been sick, some of my own family members, it all sort of feels a little bit like a cold, and it sort of kind of then it feels like a cold, and it feels like the flu, and you
Mhm.
have a real broad range of symptoms around you. Sometimes some people are like, "Oh, my throat hurts," first, and it's like with every single member of my family that got sick recently, it was all like, "Oh, I feel a tickle in my throat."
Mm,
And they wake up the next day and they can barely talk or barely swallow. So then I think it's like, something more like, strep and those kinds of things. And then they end up feeling like the flu. And so I think it feels a lot like your more common ailments. And that's why people are not paying attention to it. They're like, oh, I just have like a common cold, or, oh,
right.
I just, you know, I have an upset stomach from something I might have eaten or something like that. A little bit of this, a little bit of that. It's feeling more like those common symptoms. So people are overlooking it a lot. And I think what I would be good advice is if you're feeling some type of symptom in that category of cold, flu, and stomach flu-y type things, is like take a test. It's not gonna hurt you to take the test, but it certainly is going to help protect you and your family.
Exactly.
Great question, Haley. I think we'll have some more to ask our friend, the pharmacist here, up on the next segment here, and we are talking about we're having a conversation about COVID-19 here in Indian country, and we're with co-host Dr. Stately and producer Haley Cherry, and we're going to talk to Heather, who's our native pharmacist here in the Twin Cities, and try and talk about the myths and debunk a few, and talk about how things really work. And so we're really excited. Please hold on, hang with us, and we'll be talking more and more about this. You're listening to Native Roots Radio, a COVID-19 conversation in Indian country. Hey, welcome back to Native Roots Radio presents a COVID-19 conversation in Indian country. And I'm here with our co-host, Dr. Stately of Native American Community Clinic here in the Twin Cities, Minneapolis. And we have a special guest right now, Haley, and I'm wondering if we could read off this groovy bio for Heather.
Yes, Heather Miracle Fahey, PharmD class of 2009, is a board-certified clinical pharmacist with mHealth Fairview. Heather serves as a preceptor and mentor with a special interest in supporting Indigenous students and students of color. She is currently involved in collaborative efforts with the School of Medicine, Nursing, Dentistry, and Vet Medicine to create space and support for all Indigenous health professional students. Heather serves as several system-wide diversity equity, and inclusion initiatives, including developing mHealth Fairview's first land acknowledgement, building relationships with the local Native community, and creating cultural awareness with her department and across Fairview Pharmacy Services. Additionally, Heather is the acting secretary on the board of directors for Indian Health Board's clinic in Minneapolis. Heather is Mohawk territory in Southern Ontario, and she is the first pharmacist in her family.
Wow. Hey, Dr. Stately, we got Heather here, and maybe we can talk a little bit, Dr. Stately, about the myths and debunking this with Heather. What do you say?
Yeah, that sounds great.
Cool. Hey, welcome, Heather.
Thank you. Thanks for having me.
Yeah. Well, Dr. Stately, we and Heather, we have still issues we talked about earlier today about how we're kind of falling behind again, and we're as Native Americans, we're falling behind on the vaccines, and we're getting sick at a higher rate. Let's talk, Heather, a little bit about the myths here and what's true and what's not true. And I know I'm all vaxxed up, and we talked in the earlier segment about me having COVID and how less severe it was because I was vaxxed up.
Mm-hmm. Yeah, I mean, I think like with most vaccines, it's something that we're recommending. I also am vaccinated. My family's all vaccinated. And like we see with other vaccines, yes, you can still get COVID if you've had the vaccines, but the ultimate goal is we want to keep people from getting really severe COVID, being in the hospital, or if possible, reducing the risk of death from COVID.
Absolutely. And I know there's a lot of myths out there, and I'm wondering, Haley, maybe we can talk a little bit about those and get a response from Heather and Dr. Stately about, what they're hearing in the community and how we deal with our community members in debunking these myths.
Absolutely. So this is something that we were looking at Mayo Clinic. We know a lot of people, especially in Native communities, may have, when it comes to trusting certain medical professionals, especially people that aren't within our communities itself, we have a hard time trusting, maybe some facts or some misinformation. But this is coming straight from the Mayo Clinic. So here's what the science says about COVID-19 vaccine myths. COVID-19 vaccines don't cause you to become sick with COVID-19. The COVID-19 vaccines authorized for us in the United States don't contain the live virus that causes COVID-19. Some people may have side effects from the vaccine, such as a fever or muscle pain, but these symptoms usually go away in a few days. Did either of you experience those when you had your first round of vaccines?
Yeah, I mean, I had some muscle pain. My arm hurt, but that's very, very typical with any type of vaccine. And it's more probably related to just having been jabbed in the arm than anything else.
Right. And there's also a common myth with vaccinations and fertility. So coming from the Mayo Clinic, again, there is currently no evidence that any COVID-19 vaccine causes fertility problems. COVID-19 vaccination is recommended for people who are trying to become pregnant or might become pregnant in the future.
That's a big one, Dr. Stately. I know, and especially in the first round.
Yeah, I think that was a big concern for many people, and especially early on, like we didn't have any real like scientific evidence yet about whether or not that was going to be a challenge. I want to kind of remind everybody that remind everybody of the process by which we were able to get the vaccine. We were able to sort of develop. Science. So scientists were able to develop the vaccine fairly rapidly. I mean, that's a Herculean effort. They did it within, I think, 10 months. This was also a global-wide pandemic. It was impacted practically every single nation on the planet. And so the scale at which we moved to develop that vaccine was fairly rapid. And I know that concerned people. It also is important to note that the basis by which they built the vaccine had been built on science that had been in process for 20, 30 years. So it wasn't like we came up with the vaccine in 9 months. There had been a foundation of science built on mRNA and other sort of biological metrics that were used to build the framework for doing the vaccine. So it was a pretty safe vaccine, I think, from the very start. But what we didn't have time to do is these very robust clinical trials that we test the vaccine in human subjects with every single condition. There just wasn't the time to do that. So some of that had to be done sort of boots on the ground. There was studies that were done over the last couple of years that have looked at women who were pregnant, who or who were not yet pregnant, but who were of childbirthing years. And I don't think there's any scientific evidence that has emerged that has demonstrated that the vaccine has prevented people from being able to give birth or get pregnant. There's just no science, solid science in that area.
Yeah, it's great to remember, Heather, what Dr. Stately said there is that they had been working on this is part of a different vaccine, and that's why it came up so quick. You know, where we're coming from, where we're at, and where we are now, it's easily forgotten about things that we went through like that.
Mm-hmm. Yeah. And I mean, I think we have to remember too. So I agree with everything that Dr. Stately said. You know, this technology was not new as of, you know, March 2020. It's just that with such a dire need for vaccine, it really propelled the growth of that area. And the other thing is, you know, whether it's a vaccine or a new medication, you know, we don't do studies in pregnant women for ethical reasons. And so of course, to begin with, there's not going to be that information. But it kind of in those observational, like we can look back now and say, okay, we had pregnant women who received the vaccine. We have women of childbearing age who've had the vaccine, and observationally, we're seeing that there is, you know, no link to any fertility issues.
Well, that's really good to know. For a lot of people, there's a lot of people in our community. Also, so I know another concern with the vaccines was what was in the vaccines. And here's one. So microchips. So COVID-19 vaccines won't track your location or movements. COVID-19 vaccines were developed to help the body develop immunity to the virus that causes COVID-19. Also, COVID-19 vaccines don't contain preservatives, antibiotics, metals, or absorbed fetal tissues or cells.
Oh my gosh!
I have a special affinity for that particular vaccine or myth about the vaccine, because I think what's really important is that we let people know, like, you are more likely to be tracked by your phone, by your iWatch, by your car if it's been, like, you know, manufactured since 2010 when they started putting computer chips in them. You're more likely to be tracked by your neighbor, your dog, a few other things that are going to track you, and not necessarily the vaccine. So it's kind of it's comical. I think it has to do with, like, you know, I think sometimes these are common things, and I know people are really concerned about them, but it's like, you know, I say this with all love and respect for my cousin Roxanne, who was like an anti-vaxxer. Like, I worked on her for like a year to get her to get the vaccine, and she would not do it. There were lots of reasons why she had concerns about doing it. She was living with HIV. She had long-term other chronic health issues. She was very scared of getting sick, or having some other type of reaction that maybe would make her get very, very ill or die. And I think that
oops, we lost Dr. Stately there. Heather, your feelings on that too? It's comical, but it's for real. People do think these things, and how do we debunk them with a straight face?
I think that's a difficult question. As far as keeping a straight face, like,
Yeah.
I just don't even know like how that would be possible. I mean, these are intramuscular, like tiny bits of fluid. So I'm not even like, I don't even know how scientifically you would get a microchip through that teeny tiny intramuscular needle.
That's a good point.
It is. I mean, I would like to think like how, like what would the size of that microchip have to be, and whose little tiny fingers would put that thing together?
Right.
I can barely
I mean,
barely see the computer screen, and that's really small.
yeah. The thing that sometimes I have like I mean I'm related to many of the people that we talk about, like in these kinds of contexts. I have some relatives in this area, and so they say things like, oh, I'm so frustrated having conversations with them sometimes, but I try to be calm and I try to be reasonable and supportive, and good thing I'm trained as a psychologist because I can be like compassionate in that way. And then I say things to them like, listen, I want you to understand some really basic things. There are things that are much more likely to like take control of your life, track you, steal your identity, create a carbon copy of you. Like, I mean, like, why are you not afraid of AI? You use ChatGPT all of the time. Like, you're giving that thing your thoughts and your ideas. And, I hope you're not putting ceremonies and or, your recipe for fire bread in there because, like, everybody's going to have it.
Exactly.
So I just try to help people to, calibrate their fears and direct them in like the most appropriate way. And then I also talk about, I think it's more important to talk about or to pay attention to the things, the conditions. There are some real conditions that like make you a little bit more vulnerable when you take the vaccine. I don't think the vaccine is directly responsible for anybody's mortality and death. Like there's just no hard science from my perspective and that I've seen published anywhere that would suggest that the vaccine actually caused somebody to die.
Yeah.
So, which is, I think,
Heather,
is most people's fear. Most people are afraid of that, I would imagine. So.
and Heather, what have you come across too? Because it's hard, again, to keep a straight face, but these people are serious, and how do we talk them off the cliff or out of the window or off the wall?
Yeah, I mean, I think the thing is, it's new, quote unquote. And so there's always going to be some fear with that. And also I guess, as a pharmacist, I kind of think about it like anything that you're putting in your body is going to have the risk of some type of side effect. So whether it's a vaccine, whether it's a medication, whether it's food, right? Like not all foods agree with all people. And so, yes, there's always going to be risk of some side effects, and there's always going to be some people who are, more prone to the side effects for any number of reasons. And so, yeah, like that's a legitimate fear. But I think it's like I said, when we're looking, and like Dr. Stately said too, when we're looking at what the studies are showing and what the evidence is showing, from a multitude of sources, this isn't all drug company funded research. There's all sorts of different organizations doing research to ensure the safety and the efficacy of the vaccines. And what we are seeing so far is that the benefits of being vaccinated far outweigh the risks. So yes, you may have a reaction. You may not feel good for a couple of days. The vaccine itself is not going to cause COVID. You are not going to get COVID from the vaccine. And by and large, people who receive the vaccine are protected, are staying out of the hospital, And most likely when we do see, right, people die for all sorts of reasons, and there isn't a direct correlation or a direct link to death from taking the vaccine.
Geez, I think you guys, Dr. Stately and Heather, I think I remember hearing that whole thing about getting the flu shot too was like, oh, it gives you the flu. I don't know where that started.
Mhm.
Yeah, I mean, you don't, again, right? Like, you don't feel good necessarily after you get it. And I've definitely had the experience too, particularly after getting the live vaccine, the nasal spray, of like having muscle aches and just really feeling crummy for a day or two. Well, it's usually a day, like one day. But that is actually, your body, you're introducing,
Hmm.
a little bit of the virus, not enough where it's going to cause the virus itself, but it's just you're introducing into your body so that your body is familiar with it. And so that's literally your body is starting to work because it's recognizing this kind of foreign virus, and it's working to begin your immune response. And I guess I think about it too, like you always kind of hear about, or you've seen like in movies, like somebody's immune to poison because they acclimated their body to it, right? They took just tiny little bits of it, so then their body got used to it. It's the same idea, right? You're introducing it so it's not completely a new thing to your body, so that when you actually come in contact with the actual virus, your body already knows what to do. It's like, oh, I've seen this before. I'm ready for it. I know how to fight it.
Well, really good analogy. And Dr. Stately, I'm a kind of a delicate flower. So when I had my shots, because I had 2 shots at once, I wasn't sure it was just like I'm old and tired. That's kind of the effect I had. And then
Wow.
I was I was reminded that no, it's probably the vaccine.
Well, I mean, that's a reasonable thing for you to be concerned about because you are on the older side. You are
Yeah.
61 or 2. But I think, but I think the other thing I was going to say really quickly was like, please don't take small micro doses of poison just to test this theory at home.
Well, that's a disclaimer. We should get that
These are things,
disclaimer up right away.
yeah, these are things like you see in the movies, and none of the stuff you see in movies is actually real. So just like, but I was gonna say, also, I think part of it is like just recognize. So some of that is like a lot of people in sort of kind of the general population don't understand how vaccines work. So having Heather explain that was a really important thing. It's like you're priming your immune system to sort of like recognize something and build like a workforce, like a little army that's going to attack it fully when it kind of comes into your system in more in a more sort of like demonstrable way, I suppose. So part of that is like, it's like getting the forces ready to, it's like just like it's more like Star Wars. Remember how they like got ready to sort of fight the Death Star, that kind of same thing. So they mobilized forces for that.
I have
Your
a
immune system
question.
works the same way, so that's a really important thing. And the response that you're feeling, because people have different sort of like, I think it's important to amplify this specific sort of thing that Heather was talking about, is like not like even within your family, you share DNA and you share some other things, including the COVID virus if you're living in the same household. But I think the things that are important is like you all have your own sort of like biological thing going on inside your body, and there's a lot of things that contribute to whether or not you're going to be more vulnerable to a foreign agent that comes into your body than your mom or your dad or your nieces and your nephews or your children or your husband, your wife. Those are just things that you can't, we're not all carbon copies of each other and come with the same set of, resources biologically. So part of that is just recognizing that. And so somebody else is going to have a different reaction, just a little tiny bit of a different reaction. That doesn't mean that it's not working for you or their thing is caused by that vaccine and you're just fine, like, right? There's no evidence of that. Some of it is just understanding, like, we all have, our bodies work the same generally in terms of like creating a biological and immune response. The structure of the capacity is different. What actually ends up happening in some situations is that that changes based on any kind of other conditions that you might have. If you have immunocompromised challenges, like you have HIV, you are under cancer treatment, you have rheumatoid arthritis, things that really challenge your immune system to be able to create that workforce that responds to a foreign agent, you will have a different response to the vaccine than other people who don't have those conditions. In that specific situation, it's really important that you're having conversations with your primary care doctor about like what is okay for you to do, what is your alternative, like weigh all of the information and make a really good decision with the information and with the counsel of somebody who understands that well. And you will be in good space, I think, if you do that. Sorry.
Go ahead, Haley.
Yeah, so we're talking about, just the effects of the vaccines here. So what is it that the body is recognizing that's foreign if the vaccines that are authorized in the United States don't contain the live virus?
So the vaccines, our COVID vaccines are mRNA vaccines. So what it is mRNA is messenger RNA. And basically it's like a recipe. So like that little recipe of the COVID virus. So sorry, not the virus itself, but like a little piece of that messenger RNA is what is contained in the vaccine. And then that gets into the cells. So it basically like provides the recipe for what we call antigens. So it provides like that, like framework a little bit, or like your cells then can look at that recipe and say, oh, okay, I see this, and now I can make that little, the forces that will help protect my cells if I come in contact with the virus itself. So there's no actual virus in the vaccines. It's just basically like, here's a little clip, or here's a recipe to follow in order to get your body ready if you come in contact.
Okay.
To prepare those forces, if that makes sense.
One way of thinking of it is it contains information that your cells would use to create the ability for your cells to recognize when the actual biological material enters your body. They'd be like, oh, we recognize that thing. Let's move the battalions forward and make sure we're like killing this thing. It's basically like our RNA and DNA are like information systems within your body that transmit helpful information, helps you to sort of regulate your system, and like would be a really good idea to have a biologist on this.
Yeah.
Yeah.
Oh my God,
We'll get one on the next
biology.
Some other COVID-19 treatment myths here that I want to mention quickly. So antibiotics. I know, Dega, I'm not sure if what you took was an antibiotic when you had your bit of COVID here the first time, but antibiotics kill bacteria, not viruses. However, people hospitalized due to COVID-19 might be given antibiotics because they also have developed a bacterial infection.
Wow. Well, Dr. Stately, we talked about in the first segment.
That's good. That's good.
Dr. Stately, we talked in the first segment how you analyzed my sickness by dropping off a reef 100 feet or 20 feet away, and realized I had COVID before I did, and also
I'm the miracle worker.
Which was amazing because Wendy is a pharmacist too, and we both looked at each other and go, we didn't even think of that. And then you talking about that drug in the first segment too that I took that really helped me.
Yeah, I mean, some of that was just basically, quite honestly, just common sense. I asked you a few set of questions like, how are you feeling? What are you experiencing? And it's turned out that it was a lot like what I had just experienced myself, because I had COVID a few weeks before you. And I was like, I don't know. That sounds really like exactly like what happened to me in a lot of ways. I think you should take a COVID test.
And we're
So
like, huh?
I was a little bit surprised that it was like you text me like while I was driving home from your house. Like I'm positive. I was like, oh gosh.
No, you
Really,
said
I'm
I
really glad
told
I
you.
stood far away from you. Oh yeah, I did. I said,
You
see, I
said I
told you.
told you. But then the drug again was that I took
Paxlovid.
immediately. Yeah, that was amazing. And along with my vaccines, Heather, and taking that,
Mhm.
I know some people, I ended up having a side effect where once I was done with it, I kind of didn't have COVID, but I had really cold symptoms for about 4 or 5 days.
Mhm. Yeah, I mean the Paxlovid, it's an antiviral, which is different from an antibiotic. Um, so it's really just like preventing further replication of the virus in your system. So I feel like, it kind of like tamps down, it's preventing like this big response or like this big production of COVID in your system. Antibiotics, which are helpful if you have bacterial infection, are not going to be effective against COVID because COVID is a virus. But it's also like if your whole immune system is, working really hard because you have COVID, or you are, at high risk of other type of respiratory infections, it's probably not all that uncommon to like have COVID or be at risk for pneumonia or have pneumonia or something like that, in which case antibiotics would be helpful.
And I really like this conversation. And Heather, you might not know this, but Dr. Stately had COVID before the vaccines were out and was hospitalized. And we kind of joke around a little bit. We don't take this lightly that we do have vaccines now and things to really help us where we didn't, right, Dr. Stately? It was like
Yeah, yeah.
touch
And
and
actually,
go.
while I was in the hospital, I was treated for both COVID, and then I also had pneumonia. And I've been living with HIV for about 38 years, so I kind of like I was I'm in that little bit more of a vulnerable like bracket of individuals. And so one of the things that they did was they put me on both. They put me on a powerful. I'm allergic to sulfas, so I can't use like that really like the sulfas that they typically use for things like pneumonia and stuff. They had me on something else, and then they had me on the experimental drug because it hadn't been passed yet. Like they were just sort of like they were giving, I jokingly, by the way, I don't think I remember. Did I ever tell you this? That my doctor's name while I was in the hospital was Dr. Frankenstein.
No.
It was, he pronounced it differently, but with Frankenstein or something like that. I was like, are you related to that other guy? Yeah,
Yeah.
Frankenstein. I was like, are you related to that other guy? And he's like, and at least I had a good, sense of
Yeah.
humor about the whole thing. I was like,
You mean that
if I
Mel
get out of
Brooks
here,
movie? That Mel Brooks movie you're talking about?
yeah, that one. But I was so like he was a great infectious disease doctor because like he helped me like he talked with me as like you have HIV. He goes, by the way, you also have diabetes. Did you know that? And I said no, and I found that out while I was in the hospital. So I had like all these things. Like I had like the list of like risk factors that we typically talk about is like I just had them stacking up like in the hospital. I was like, and he's like, you know. And I did say to him, like, am I going to get out of here? He goes, we're working hard to get you out of here. And I said, yeah, just don't let me leave with those little green things on the top of my head. But they had me on really powerful antibiotics at the same time they were on the antivirals because I had both conditions. I was pretty ill, very, very ill, actually. So. Yeah, so I think those concerns that our people in our community have are very real, and I don't mean to make light of them, but it's like some of them are just completely manufactured out of the dark, right? It's a little bit like I think some of this also has to do. This is just my perspective. I think some of it has to do with like when you don't have a lot of information and you don't know a lot about a subject. Like when there's a lack of knowledge or understanding or awareness, there's a big, huge chasm that can be filled with like all kinds of like just, backyard conversations about, pseudoscience and stuff that make people anxious and scared. The best thing we can do is doing what we're doing today, which is just giving information. I think people can make great decisions about their health and their well-being and their safety when you're giving them really good, solid information about that has been tested and over the course of several clinical trials and those kinds of things. Just give people information, they can make good decisions.
Yeah, and right,
Yeah.
like I think it's not necessarily that like these concerns are coming out of the dark.
No.
There's a lot of trust issues when it's like, oh, the government is telling me to do this. Well, I don't know many Native people who trust the government.
Yeah.
But right, it is having those conversations and getting reliable information. A Google search is probably not the most reliable information that you're going to get. But having like a trust
or others.
Yeah. Oh, right. Yeah. Facebook.
Oh.
Because everybody, you can share whatever you want. So, but yeah, having like trusted resources, reliable resources, and just getting like good information from people who do care about you and that you trust is important.
Yeah, I agree.
Yeah, well, that's why it's so important that we're talking to you. We're talking to two doctors, really. You're a doctor in farm medicine, and Heather and Dr. Stately is just, again, he recognized that I had COVID from 10 feet away. It was. I'll never forget that. It was because, again, Wendy and I looked at each other and didn't even think of it, because this was the first time that I had COVID, and I'd been out. We talked about, George Floyd, when the first day of the protest of George Floyd's murder, there was no vaccine and there was 10,000 people there, and I had a cloth mask, and we find out later on that cloth masks aren't very good. I mean, I had a cool native design on it. I looked rugged, but other than that, I was lucky to get out of there without having COVID, because people, I think the big thing was a mask and being 6 feet away from people.
Yeah, and I was in some of those protests too, and like after that, and there's no way to be 6 feet away from anybody in some of those conditions. So I think in those conditions, we were really lucky that we maybe not get it, but I think we have so many other things now. We have more information, more understanding about it. We have more tools in our toolbox to address it. We can do a better job in our community and in our families and quite frankly, in our nation to responding to it. A lot of the things that are preventing us, like the reason we're seeing some of this uptick is that we've gotten, we're a little bit COVID, what's it called? COVID exhausted, weary. Yes, it's just been beating us down for a few years. And I think also, like, we did a few victory laps, celebratory laps, like, oh, COVID is over, because we're seeing a dip in deaths and dip in infections. And the thing about, like, I keep reminding people is that it's a virus. Viruses mutate. Almost all viruses mutate. The majority of them do. And this one is particularly stealthy. So it's kind of like, we're going to always have to be a little bit on our, just keep it in our awareness, try to keep it maybe not right in the front of our, but like next to the front of our brain, so we can remember to like address it with the tools that we have. We've developed a lot of tools for it.
Yeah, I'm thinking about it kind of like the flu shot. Like, it seems like we might be having like yearly. Sorry, I got some background noise here, but right. But like we tell people to get their flu shot every year. I think it's going to most likely be similar to that, like just every fall.
So.
Yeah, definitely.
Your sons sound exactly like mine when they come home from hockey, by the way.
I'm for a snack, I think.
Well, I kind of sound that way when I'm hungry, but that's another story and another show. Haley, who do we have with us again? I know
Yeah.
Heather's got to get going here. So, but let's read some of her bio because this has been really a great conversation.
Yeah.
And
Thank you. Yep. Heather, thank you so much again, Pinagigi, for joining us during this vaccination segment of our conversation. Again, we're with Heather Miracle Fahey, PharmD class of 2009, Mohawk, and she is a certified clinical pharmacist with M Health Fairview. And additionally, Heather is the acting secretary on the board of directors for Indian Health Board Clinic in Minneapolis.
Heather, before we let you go and tell your kids or what's up and what's happening, any last words about this? We've really appreciated your and Dr. Stately's conversation about this.
Yeah, well, not Nyawe for having me. I think it's important, like you said, to just keep talking about it and to get some good, reliable information out to community. Yeah, and I think, if there's questions, like I'm always happy to take questions. I'm around. I'm at powwows and showing up in community at different places. So always happy to just field whatever questions people have.
Dr. Stately, any last comments before we let Heather go?
No, I think it was a great conversation. Thank you so much for being here today. It's good to see you again.
Good to see you too. Yeah.
All right. Right on. Well, let's take a break here, and we'll come back with Dr. Stately and talk some more about this COVID and where we're at now and how far we've come. You are listening to a COVID conversation here in Indian Country, and this is Native Roots Radio. We'll be right back. Hey, welcome back. This is Native Roots Radio presents a COVID-19 conversation here in Indian Country, and I'm here with Haley Cherry and our co-host, Dr. Stately. We had a really nice conversation with our favorite Native pharmacist, Heather, and now we're going to kind of wrap it up here in this last segment and talk about, a lot of things, mental health, how that fits in this, which is really huge, and I just want to welcome you back, Dr. Stately and Haley, and this has been a really great conversation.
Thank you. It's nice to be with you all today.
Yeah. So Haley, we want to circle back, correct, on our conversation here, and ended up. Let's talk about a few of these things.
Yeah, so just before the break, we were talking a lot about debunking myths and certain facts around vaccinations. But this has been a global pandemic that has been ongoing for, we're going on the 4th year. And I'm not sure if it's described as a pandemic, but COVID is still a real thing, and it's affected us in many different ways. So we know it can be stressful to experience COVID and all the challenges that may result from it. So if you're having any kind of mental health crises from this, or just need to talk to someone, please reach out, to these resources. We have some really great resources coming up. Always, if it's an immediate medical experience, please call 911. But for free confidential support, you can always call or text 988 to reach the National Suicide and Crisis Lifeline. And that lifeline is open 24 hours a day, 7 days a week. And they also have a lifeline chat that is available in English or Spanish. And services are also available for people who are deaf or hard of hearing.
Yeah, really good points. And I think one of the things that I'd really like to talk to you specifically about, Dr. Stately, is like, how this really fits in mental health and mental stability. Having COVID, possibly having COVID, going through this pandemic, all those things, that big ingredients of depression and things like that. Let's talk a little bit about that.
Sure. I think one of the things that stands out is just this, so it is exhausting that we are entering into our 4th year of this epidemic or pandemic. And that, the scale of loss for our community is so large. Like you can look at data all the way back to the beginning of the pandemic, and just thinking just from the Minnesota data specifically, because this is where we're at, is and it's where I work and it's the community I work in, is like we have lost so many people to the pandemic, all across, from young ones all the way into our elders. We've lost so many of our elders, and thinking like the impact that has had on our community and our families and our individuals is, demonstrable. And think about the people, when you lose so many people who are elders in our communities. Like I remember being in conversations with people in healthcare leadership. I'm on this thing called the Tribal Health Leadership for the state of Minnesota, an advisory body of the state, and we meet regularly and we meet quarterly. And especially during the pandemic, we were meeting like every other week, really, to try and strategize on ways to sort of manage it. So one of the things that was really a high topic of conversation was the scale of loss we were having, losing people, elders, first speakers. People were like anxious about we're losing all of our first language, speakers. We're losing our cultural resources. These are things that have been really challenging for our communities. And so in a lot of ways, it pulls on that thread of historical trauma that we've experienced as communities of Native communities across the Turtle Island for the last, several hundred years.
Mm-hmm.
And those conditions, get triggered, those experiences of us, our emotions, our psychological responses get triggered by something of this scale. So here we are 4 years into this, and we've lost a lot of people. We have family members who either succumb to either COVID or they succumb to one of their more chronic health conditions because they weren't able to get into the hospital, or they weren't able to get in to see a provider for a couple of years. I have a cousin that I lost like rapidly. She, it's coming up on her 2nd year of her having passed away. My cousin Roxanne, who was an avid, vaccine resistor. She died from her liver cancer. Her liver cancer came back, and she hadn't been able to go back and see her primary care doctor during COVID. Right. She passed away the year before that. Her husband passed away from his cancer. So these are the kinds of things that we are experiencing in our community. It wasn't just not just dying from COVID, but the scale of loss from other conditions. We've seen a significant rise in other conditions in our communities, like
Wow.
scale of houselessness. The scale, we are, the amount of people who had overdosed over the last couple of years because they weren't able to get into care. So those things are also present, and that is a heavy weight for anybody in tribal communities to carry around, just the idea of like, gosh, my relative isn't here. And then you got things like survivor guilt, like, well, why me and not them, or why them and not me, right? That kind of thing. And it's like, those are real things that we contend with. and they weigh heavy on our hearts, heavy on our minds, and make us more vulnerable to like depression, anxiety, guilt, remorse, all those things that are those heavy emotions that we carry around that can really impact our ability to function in our families and our day-to-day life, make it hard to get up, go take care of like the things that we need to take care of. So those are real conditions, and important to note.
Yeah.
Absolutely. And Haley, I'm wondering if we could maybe talk a little bit and put out some numbers for people listening or have relatives that might need to reach out to have help. I'm wondering if we can get those numbers out there and websites and things.
Yeah. So if anyone is dealing with just needing someone to talk to and would like a more culturally specific service, we recommend Strong Hearts Native Helpline. You can learn more and chat online at strongheartshelpline.org. Or you can call their hotline. But specifically, I just wanted to put the website out because we know computer use can be monitored and is impossible to completely clear. And this might be a concern for some of our relatives who may be experiencing domestic or sexual abuse. So if you're afraid that your internet usage might be monitored, please reach out to Strong Hearts Native Helpline at their number, which is 1-844-7-NATIVE, which is 1-844-762-8483. And some of their services that they provide include just providing a culturally someone who knows about the culture and what generational trauma is. And they provide peer support and advocacy, as well as information and education about domestic violence and sexual assault, personalized safety planning, crisis intervention, basic information about health options. Again, Strong Hearts Native Helpline's number is 1-844-762-8483, 1-844-762-NATIVE.
Absolutely. That's so important. And thank you for getting those numbers out there, because we always talk about what's the call to action. So great to bring those numbers into the conversation, Haley.
Yeah. And they're 24/7, so you can call or text or chat online any time of the day, the night, and they have advocates all over Turtle Island, many advocates. So I know some of us worry about privacy in conversation, so you never have to worry about who is this gonna get around to? Is this gonna get around to one of my relatives? So
Right.
Strong Hearts Native Helpline is a really great resource for us in the Native community for more specific care. But kind of to wrap up our conversation here, we're going into the holidays season, and it's really important to just know that to test. And if you have symptoms, to test before you're in large groups, especially around your elders or your family. So how do we treat this? How do we keep people safe? What are some ways that you two are going to protect yourself and others going into the holiday season?
Wow, that's a great question. I'd like to hear what Dr. Stately has to say so I can copy what he says, because I haven't really thought about it. But that's a great question.
Mm-hmm.
Yeah.
So, Dr. Stately,
I mean, I think one of the things I'll do is I'll keep I have a couple of family members who are fairly vulnerable. Like my grandma's, she's 81, 83 years old, something like that. And she's got some lung condition. So I'll do things like not visit her and especially if I'm not feeling well. If I do go visit her, I might wear a mask. If I drop off food, I'll drop it off at the door, and she doesn't need to see me in person to know that I love her and care about her. So I'll do those kinds of things. I'll keep any gatherings that I have. There's small and sort of very insular. I do have a wedding that I have to go to on the day after Christmas. My kids' aunt is getting married, and we're to go back to South Dakota for that ceremony. But I'll be really cautious, and want to make sure that I don't bring anything back. I'm going by myself and with another individual, so and I'll be really cautious about if there's a lot of people and it's tight and I'll wear a mask, and so
Yeah. That's I guess I can say ditto, but um, just to make sure everyone's protecting themselves, and of course, if we or Wendy or I feel under the weather, and to really let people know and that we love them and that we won't be meeting for the holidays. So I think to have that in the forefront and have a game plan, because we don't want to get other people sick. They're vulnerable for all sorts of reasons. And again, I did not get COVID and did not get sick, and surprisingly, in my mind, I got it. So I think anyone can catch it on any way, and I just want to say that, and also, it was really interesting, Dr. Stately. Wendy didn't get it, and I mean, I accidentally drank on her mineral water a couple times, and I had Kleenexes all over the place. So it's tricky too. So you have to stay vigilant, and I'm glad she didn't get it.
Yeah, I mean, I think those are the things we talked about this before. Is like just like we cannot count on it's possibly luck. So it's like there's just a number of things that you got to be thoughtful about. You just don't know. So I think exercising caution and good decision making and erring on the side of being more cautious than not is a good thing, especially if you're like sharing space with people who are older, who
Mhm.
are immunocompromised, who are very young, who can't get the vaccine, or who can't there are other things also that are going on. So I just think the other thing is to make sure that people understand that it's like we have COVID, we also have like a flu outbreak, we also have RSV. All
Mm,
of these things, actually, by the way, we have vaccines for now. Just so
mhm.
also to amplify that, you can get a flu shot. You can also get a RSV vaccine for people who are very vulnerable, and that's really important because those are all lung conditions. If you get all three of them at the same time, that's going to be a challenge for you. So,
Yeah.
just doing things like you can, it does not take a lot of work, and it might not look really cool to
Right.
wear a mask on your face anymore. It's like, but
But I see it
is.
in the community. I see people wearing masks. I was at a play last night. Also, one thing,
Mhm.
Dr. Stately, I want to bring up here in the last waning minutes of this great conversation we've had today is, you know, I had sanitizer everywhere when COVID first came out. And that's one thing that I could do better in the holidays and just every day is sanitize my hands, make sure places are clean that people come
Mhm,
to and
mhm.
surfaces.
Yeah, there's just really simple things you can do to mitigate and lower the risk that you're going to transmit or acquire the virus. So that's really important, is that we remember those things and we reactivate those things. And
Yeah.
I haven't went out and bought any sanitizer recently, but do you remember a year ago it was like 25 cents for a bottle of vaccine for
Right.
for sanitizer in some places? It's like, well, I'm probably back up to like $3 a bottle now.
Right.
Mhm.
So
Yeah. Well, I think I have
yeah.
some left over. I don't think it I just haven't been physically putting it on. I think our
Mm,
nations, tribal nations were really huge into handing out these kits, especially before
right.
the vaccines.
You weren't hoarding it, were you? Like that toilet paper guy?
Easy, well, a little bit, with my 500 T-shirts, that Wendy complains about all the time, but yeah,
Well, yeah, just going into the holiday season again, it's very important to monitor any symptoms. People you've been in close contact with, anyone who's sick, is showing symptoms. Keep distance between yourself and others when you're in indoor spaces, especially with poor airflow or ventilation. Again, wash
mhm.
your hands with soap and water for at least 20 seconds. Not just a little quick rinse off with some water. We know water is
Oh.
life, but soap actually is disinfecting. So whether that's sanitizing, at least make sure to use sanitizer that has at least 60% alcohol in it.
Yeah,
Yeah.
I see a T-shirt again. Say that again,
I
Haley.
do see a t-shirt. Yeah.
Yeah,
Water is
water
life,
is
but
life,
you
but
add soap.
Add
Add
soap.
soap.
Oh my
Wear a mask, face mask in indoor public spaces. You know, if you're around a number of high people that's been exposed to COVID-19, especially people who work in hospitals, wear your mask, wear the right mask. We just want everyone in our community and outside of our community to be safe this holiday season and
Wow.
enjoy
For
themselves.
sure, for sure.
Definitely.
I want to amplify that message because it's really important. Like the number of people who are dying now in the state of Minnesota, the majority of them, like 95% of them, maybe higher, is like people who are over the age of 65. And
Mm,
Native people are leading the numbers in the state of Minnesota on the number of deaths, severe hospitalizations and deaths for COVID. And I want to remind people like these are our culture bearers. These are the people that know our stories, that know our language, that know our medicines and things. Let's protect them because we have a responsibility to protect them, so that their knowledge and their wisdom and that secret sauce that they hold about being an Indigenous person is something important to preserve for our children and for the next 7 generations. We have a responsibility to protect that over
Yes.
anything else. So.
Yep.
Be a good relative and protect others.
yeah, really great information. And thank you so much for speaking on this, Dr. Stately. This has been a really, I hope everyone's listened to this because it's really a great, great reminder. And, we all need to be reminded of this and keep everybody safe. Like Dr. Stately said, great job, Haley, our producer. I just want to give a big shout out. And Dr. Stately, thank you so much. And I want to give a big shout out to Heather for coming in and talking about the myths and stuff. Please, I think maybe one last time before we leave, maybe a quick helpline. Throw that out there again to our listeners.
Yes, this COVID-19 symposium was brought to you in partnership with the Minnesota Department of Health. To learn more and stay up to date with the most recent COVID and vaccine news, please visit health.state.mn.us. That's health.state.mn.us.
Pinigi, and thank you. Everyone stay safe out there. Thank you so much for co-hosting this, Dr. Stately.
Absolutely. Gigwabman.
Right on. And Pinigigi Haley for all your work here on this great symposium. We'll be listening to Native Roots Radio weekdays at 5 o'clock Central Time on all your podcasts. And we're still here. We are the